Hey everyone, welcome to the Christian Health Service Corps Iron to Silver podcast. We hope this will be a resource for you. We hope it will be your source for insightful conversations with expert guests in the area of global health, patient safety, and improving quality of care in low and middle income countries. Join me, Greg Seeger, Christian Health Service Corps founder, and Dr. Sarah Pruitt and Dr. Kelly Frazier as we share stories and explore strategies to improve healthcare in low and middle income countries.
Welcome to the Iron to Silver podcast, where we love to talk about quality and safety and just awesome things being done around the world of Christian medical missions work. And today I am super excited to be joined by Dr. Sarah Pruitt, of course, who is often the co-host here or the host. But we have Joel White, who we know and love, and we can't wait for you to meet as well. Joel is currently working for Samaritan's Purse as a readiness supervisor for the SP Emergency Hospital, as many of you are aware of that and the program through SP. But Joel, that you might not know, is he's got his master's in healthcare administration. He spent at least 7 years in international Christian medical work doing emergency relief, among other things in programming. And we got to meet him as he was our boss and partner in the launching of Iron to Silver, working for CHSC as a director of programming. So we miss him, but we know he's doing great things with SP, and we're just super happy to have him here with us today, talking about his current work and his vision for the future. So Joel, thank you for being here, and we're just excited to see you.
It's exciting to be here and exciting to get to hang out and talk with friends, dear friends, and get to share the things that we love about what God is appointing us to. So
awesome. Well, tell us a little bit now of just give us an overview of what you're doing now, and even just the background of how you got involved in global health in the first place. Kind of take us through it.
Yeah. So right now, God has allowed me to be a part of a team with Samaritan's Purse called the International Health Unit. And within that team, a bit of a Russian doll situation. It's called the Emergency Medical Response Group. And what we cover is mainly the medical operations side of our emergency field hospital. So this is a hospital design and strategy within disaster relief to bring about OR capacities, triage, ICU capacities into disaster zones, from conflict to environmental disasters. And so my job particularly is to, as we say, feed and water our hospital systems here at the domestic level, at the warehouse. So in order for us to respond to disasters and put a hospital overseas, we have to be prepared. We have to be ready. And so I'm working with two others and some other specialists to make sure that we have all the physical material in our warehouse and packed in a manner that can be deployed immediately. So I help feed and water the hospitals here. But you asked how did I get here as well. So I got involved with global health or medical missions in a way personally after college, but I kind of grew up with it. My dad's a family practice physician, and we lived on the Texas-Mexico border in Harlingen, Texas. And my dad helped teach and start a Christian residency program down there called Valley Baptist Residency Program. And so growing up, I got to see my dad and others share the gospel of Christ through medicine, going in and out of Mexico or even just the community around us there. And so leaving college, wanted to pursue medical missions in its own way. And so I moved to Tinwick Hospital for a year got to sit under Dr. Mike Chupp, who's now the president of Christian Medical Dental Association. Love Mike, and so anyways, got to grow up a lot in that year. And Mike could contest to that. But came back after a year there, seeing again how God uses medicine, community health, and in those areas and those sectors of work to share the gospel, to bring healing spiritually and physically. So got my master's in healthcare administration and joined CHSC right immediately after. And so that's how I got involved. Yeah.
Yeah. And before that, obviously you met your wife on the field doing some disaster work. So explain how you were able to kind of work through that on the disaster side. Obviously healthcare administration seems to me at first glance very, I feel like you're in an office running a hospital, it's on the very eye. And then you think about disaster relief, of just running in and no offices and just kind of coming in and very opposite sides of things. So how did you kind of go from this master's work into, well, now I'm going to run into disasters instead? Or how did you see the marriage of those together?
Yeah, that's a great question. Because you're right. I could not envision using my master's degree or pursuing hospital administration and being involved in a field hospital at that regard. So working with Christian Health Service Corps as a programs director, coming alongside missionaries, getting to help programs around the world. I went to a mission conference and saw that there was a presentation on operations and logistics within a disaster setting. You're like, well, that's interesting. So I sat there and listened, and sure enough, like when you think about running a hospital and the many components of, or we'll not say components, we'll say the underlining goal of hospital administration should be to make sure that everything's functioning in a way that the doctors and nurses can just take care of patients and not have to worry about anything else, right? Other than that, that's the ideal, right? Whether that happens or not.
Yeah, amen.
So,
say amen.
There's a lot of business to that too, right? But essentially, it's the same thing in a field hospital, and that was a really cool thing and that's the connecting point for me. In that is in medical operations and logistics within a field hospital, your job is to make sure that all the plumbing, all the tents, all the biomedical equipment, all the electrical, all the food, everything's functioning and running correctly, so that the doctors and nurses and the medical professionals can take care of patients without worry. And so you're coming alongside and supporting those who can serve in a pretty unique manner in that. And that's what we did with CHSC, and coming alongside as programs, director of programs, or working with programs. And so it connected really well. And like you said, through that endeavor, through working with the field hospitals overseas, I met my beautiful wife, Kiana, in a field hospital in Honduras. And she's a nurse, NICU and oncology nurse, and I was the medical logistics guy. And so, real, I don't know what she saw in me at all. I had hair back then, so maybe help. But anyways, yeah.
Not the reason to go on a disaster relief, but sometimes a side effect of working together is finding your spouse. So,
yeah.
If there's any single people listening, go overseas, and you already know if you see someone there, they probably believe in a lot of what you believe. So, already got a lot of things out of the way there.
Tell us some of the places you've been in, some of the situations you've been in.
Overseas, probably.
Yes.
right?
Mhm.
Okay.
Yeah.
Is this work related or is this kind of fun story related?
Either.
No, we'll go work. So, with CHS, so lived in Tenwick, came back, right? But working with CHSC, that probably sent me traveling the most. So with CHSC, I was able to run over to Ghana, Cote d'Ivoire. Didn't go back to Kenya, but we went to Ethiopia. We Honduras, Mexico, and then with Samaritan's Purse, I was in Mozambique, Ukraine. So my wife and I went to Ukraine a day after our honeymoon. That was a lot of fun. And let's see, Ukraine, North Carolina. Actually, we set up a field hospital in North Carolina for COVID.
Oh, right.
And, so I think there might be some more others, but that's kind of the gambit of it. Yeah. So
What do you see, being in so many places, you kind of get a unique view. I think some of us who travel a lot, there ends up being similarities that kind of follow you in these countries. Sometimes you can go to one place and you think that the issues there or the difficulties working there or the challenges in providing safe quality work might be unique to that place or that culture. But what are some things that as you go, you've noticed that this is a barrier to safety and quality, no matter where you are, especially when you're in that context, whether it's programming or disaster. There's sometimes ends up being, I'm springing this question on you too. So sorry, but of just what are some things that
That's
end up
good.
being like, honestly, no matter where you are, even no matter what culture you're in, these are the barriers in these like LMIC contexts that really are maybe why safety and quality doesn't always happen. Even in the Christian context where we're trying to represent Christ well, and representing Christ well means, treating people with dignity and giving them our best. But what are some challenges that you find that keep running up against those goals that keep us from achieving that, kind of regardless of continent, if you will?
Yeah. Well, great question. Yes, was not prepared, but I love it. Like we love these kind of conversations, right? So, but immediately my heart and mind goes to that which all men struggle with: pride, humility, like being humble, but pridefulness, and we'll say everyone building their own little kingdom. And so in any context that we've been in. So what was unique about CHSC and different from Samaritan's Purse that I work with, CHSC, we worked with brick and mortar, and we went into these hospitals, and this was long-term care. This was long-term mission work. With Samaritan's Purse, it's very fast, quick. You're doing everything for them. You're setting up literally inflatable tents, and one day they're not going to be there, kind of thing. But in each scenario, what we have found, what I've gotten to see is if there's not a humility to say, I don't know, humility to say, even that which I'm passionate about isn't the thing that everybody needs. And willingness to say, hey, God's appointed me here, and that's good. And I'm going to run my race. I'm going to work hard. But it's not about me. And so if what's needed is community health rather than, or we'll say what's the focus right now is community health because that's a need. Whatever specialty you are, whatever you're passionate about, can you have the humility to say, okay, let's achieve that together. You not diminishing who you are and what you're called to, but in a way, not pinning yourself against them and saying, well, I want this. I feel called to do this. I can't see you thrive and me, just be in a plateau, that kind of, if that makes sense. And so it's interesting to see Christian healthcare workers and even and others, just say, I have an agenda and I want to see that agenda met. And then when things start to implode, and there's internal conflict and things aren't working, you wonder why. Well, no one gave way. No one said, okay, God, what is your plan here? Not mine. And can you have called me here and said, I need you to play the background? And so I think, and that's not for me to be prideful in and saying like, oh, I've not struggled with that and stuff at all. But we get to see that. And so we see that in emergency field hospitals, if one person comes in with, how things should be, and you said, well, what does leadership say? What does people who know and have been here, who have set this up, if they say something different, do you have the humility to say, okay, I trust you. God has appointed you to this. I've gotten to share my voice, but I will continue to follow.
Wise
so
words.
That's a big one.
Right. I mean, because you're expecting to be like resources, right? I've just read lack of resources, right? Is kind of there are just finances, and these people just don't have the financing they need to accomplish what we need. But really, it's so true. And I think especially as trained, a lot of us go overseas as professionals of whatever kind of trained, and you feel like God's calling me to bring my gift there of what I'm trained to do. And that's why I'm supposed to do that. So it is a slap in the face when all of a sudden they're like, we're glad you're here. But we don't actually need that skill set at all. And we need you to fill this other skill set. And it can feel like, well, surely the Lord is not, the Lord prepared me for 20 years of medical training in order to bring this skill here at this moment. And are we open to say, actually, that's not why the Lord probably did call you here, but maybe he called you here for an entirely different purpose than you're even understanding. I know one missionary said, she was a surgeon and trained her whole life, showed up overseas, and they hadn't had a surgeon for years. And she was, driving along with like a hospital admin, a missionary that had been there a long time. And she's just like, I'm just so glad I'm here, almost like they've gone so long without these skills. And I think the person in the car said, did you ever think maybe the Lord called you here because you were too stubborn to learn what you needed to in your own country? And he was like, well, wait, what? Well, no. He called me here because I'm educated. I'm here to bring my skills. And he's like, well, maybe you're just here because the Lord hasn't been able to teach you what you needed to learn in your own setting. And this is about lessons for you and the Lord humbling you to learn something. And she was just like, wait, what? Like, but she took it. She took it, well, and just was like, whoa, and I always say the Lord gets to write everyone's story at once. It's not just about these people in need. It's about we're in need. We are people in need spiritually and emotionally and trying to be more Christ-like. And the Lord gets to use these things to change us all at one time. I mean, so I think those words were just so insightful and so true. Are you willing
I agree. I think those are good words and wise words, and we appreciate that. And I think a lot of myself included use the phrase a lot from Esther. Maybe I was here for such a time as this. And then all of what that entails, right? You can take that in about 25 different directions on any given day for the work that you're doing, and and it fits because it just does. But just to piggyback on that idea just a little bit, I mean, you have a master's of health administration, you're extremely educated and accomplished. Like, you could be running a hospital right now. Like, what draws you to global health and to doing this work with people the least of these and the people that don't have around the world. Like, what is your passion in that, in this, pursuing this avenue instead of the nothing wrong with avenue of just doing healthcare administration? I mean, like that's a calling as well, because hospitals need help everywhere. So
yeah. Yeah. So I'll say probably there's some stubbornness when I was younger. The reason why I didn't go directly into a hospital, like corporate hospital system, and that stubbornness came from I didn't want to wear a tie. I didn't want to dress up and be in a business office. I like getting my hands dirty, and what got me that closeness to doing things like that. But I think when I came just a little bit more mature, you start to formulate like, yeah, what is the purpose? Like, what am I truly working towards? Why do I choose this over something else? And I recently kind of wrote this down as we were thinking about family mission statements and personal mission statements and things like that. And I do believe that God has put it on my heart, a passion and desire to come alongside communities and seeing them build healthcare capacities within the community that reach the holistic being, the physical, the spiritual, the emotional, the social, and I desire to pursue that. And so whatever way, and so looking at through like a lens, whatever job God or position God appoints me to, that's been true through the lens of getting to partake in building capacities, caring for those communities, and bringing greater health. And when we say health as Christians, we mean not just the physical, right? We mean the gospel and how that intercedes into all aspects of life. And so that's how I would say it. And not that you can't do that as a hospital administrator, like running a hospital somewhere. I think for me, I think God's just given me eyes for a lot of different, like the vulnerable communities. When we were in Dallas, like I wanted to live in the refugee complex, and I wanted to live in the low economic area, and not because that's glamorous, but that's where my heart, my eyes went to, and I think there's nothing better, but it's like this isn't better than that, but it's I think that's what God's drawn me towards.
I was just going to say, Joel, what do you some of those successful moments?
Kelly,
right?
what do you got?
I think a lot of times, the more you're doing this kind of work, sometimes it's easy to think of the things that didn't go well, that the struggles and why didn't that work? And that's kind of the question I had before. But thinking of the times where you like either that it just worked well, right? Whether it's a programming over a long period of time, whether it's an emergency field hospital where for a period of time it was just like, you're like, this is what I live for. What do you think what made it that way? What made it work, or what made those programs successful? Do you feel like there was kind of so the opposite question? What was there a thread through? What kind of made those things work? Why did some work and some not?
I think I don't know if it's frozen on my side, but Kelly, you froze on me. But I think I got your question. Like the what was there a consistency of what worked, what allowed programs or hospitals to kind of thrive, and what we've seen there. I think I don't know. I think an easy thing is to go back to some intangibles in a way where community buy-in. And we talk about this in community health, and we talk about this even in the hospital. if you don't have community buy-in, it's either going to be super hard or it's ultimately not going to be successful. And if you're not working to, in a mission hospital setting, if you're not engaging the community in a way that's building healthy relationships, or if you're not tending that relationship well, there can be a lot of hardship and a lot of things not be successful. New endeavors aren't going to go so smoothly if you want to, build a physical therapy unit, but nobody comes, kind of thing. And for field hospital, it's all about relationships, is that too. Like, you have to be invited in. So I think, I think this was kind of a surprising thing when I was learning about international field hospital work. But you wonder why. Well, why do you go there and not there? Well, a lot of times it's they invited us and they said no.
Right.
And so you can be invited and you can bring a hospital into a place and have such a bad relationship and bring so much pride and bring so much, kind of just do it in a manner that's bad, that you don't get invited again, and you get kicked out. And even when we fly airplanes, so, people who are listening to this, you may know that Samaritan's Purse has an airplane. Well, for that airplane to go over countries, you have to get permission.
Yeah.
Well, we were able to go to Armenia during this refugee crisis a couple months ago, only because we had recently got to set up a hospital in Turkey, because Turkey would not allow people to fly over their airspace to get to Armenia. So you're like, okay, praise the Lord that the people on the ground were really kind and had a really good reputation. So I think just it goes hand in hand of, like, if you love people well, if you walk with humility and you strive to do good things in that, and like working hard to do good things in your profession, people recognize it. And I think God blesses it with the success of opening up doors to other things.
And it sounds so cliche to be like, be kind, you never know who it's going to affect. But really, it's so true. Like, that team in Turkey would have no idea that refugees were going to be ministered to, because they had a good, loving, respectful witness to the context that they were in. And that allowed the yes, to Armenia. Like, who would even think that such a global impact would happen because you represented Christ well in a respectful, kind, dignified manner, in a neighboring country. It's right. God's so big to weave all those things together in a way that are just, it's mind blowing, really, to think about.
And we think about, in a brick and mortar scenario of medical mission hospital, if you go to the local restaurant and you start acting super disrespectful, that goes around town in a manner that's hurts your hospital. And you're like, well, that's a lot of pressure. You're like, yeah, act like Christ. We're ready to go. And that's a lot of pressure. That's hard. That is hard. We don't do that well ever, because we need Christ. But walk with grace in that. So anyways, it feels awkward. So do I get to ask you guys questions?
Sure. Yeah. It's only.
So what would you say something different? Like, you guys, everybody who's on this podcast, if you don't know already, Kelly and Sarah have, I think it's like 14 years of experience overseas, working overseas. Did I lowball or highball that? I don't know. Sorry.
You lowballed it a little bit.
Okay.
That's fine.
21 years.
We were from birth.
Born into the jungles of Togo.
And asked him to go on an airplane. No.
That's great. So Sarah and Kelly have worked many, many, many years and have had a lot of great experience and a lot of hard experience. And I think if you could share your side of this, what would you say in the many years and different programs and projects and things that you've worked on? what would you say is a consistent thread of success?
The biggest thing that I would say would be it's not the individual. It is, but it's not the individual case that you're involved in. Whether I was in a hospital setting, so I did a lot of individual case care. But as a global ministry that we had in Togo, we, not me personally, were able to start so many Bible studies in village churches around that area because of the care that happened in the hospital. I mean, I wasn't going out starting those churches, but they would leave there, whether the outcome was good or bad, whether their loved one lived or died, and say, hey, something's different there. Can you come tell us the things that you told us in the hospital? So to our whole village, and that would start a Jesus film, and then that would start a Bible study, and then that would start a church ultimately. And Kelly and I were involved in a case of a little boy that ended up dying, but stayed in our hospital for about a year off and on, and then actually was in our home for a while and, didn't have a good outcome. And we, at all, by any type of human standards, we lost him at the end. But we would go out and visit that family, couldn't speak the language. And the way that the Lord would work, he would bring somebody by that spoke their language and we would be able to talk to them and just say, hey, we still think about you. We still think about Tama. That was the little boy's name. We still think about, is there something you guys need? I mean, you're talking about dirt poor, dirt walls, pig farmers. I mean, just very, very low, the lowest of the low. And the tribe is a very dark tribe. And then one of our chaplains got interested and he came out and started a Bible study with mostly women. I mean, women tend to want to sit around and talk, and then they started a Bible study, and we had two of them, one in kind of next to each other. Well, fast forward that now to now, and there's a church with a building and a kids program and men that come to church, and and they're having they have baptism services 2 or 3 times a year because there's that many people that want to give up all of the non-Christ-like work and say, well, gosh, this church, we're not changing their subsistence farming, but man, there's something different now in these families. Like, what is it? And and that family actually, they changed all of their names to Christian names. It's really kind of cool. They renamed all their kids. So,
wow.
And, but anyway, so we still keep up with them, and it's just, those are the things like that you take with you forever, that you're like, oh my goodness, Lord, you let me be.
Right? You couldn't have programmed that in.
No.
Right. And, and people stay on their field their whole life and don't get a story like that,
Yeah.
So I feel so blessed that the Lord let us have that story, even through heartache and through everything else, to say, man, that was a complete ashes to, from the ashes story, complete full circle. So it's really cool to see that. So
that is a beautiful story, Sarah, an incredible encouragement. And what you didn't say is that you and Sarah, you and Kelly, in your willingness to be obedient to what God asked you to do, and invitate the hospitality, the going, physically going into that village and home, and that's through your faith and through you abiding and obeying. You got to experience that, and that was a beautiful thing.
Yeah, I think, when I think back on, especially maybe, Togo time, I mean, we did other work that was outside of Togo, but I'm always scared that people who know me on that field are going to listen to this podcast and be like, what is she talking about? Because a lot of the things, maybe we or I didn't do well, honestly, and when you think back on what ended up being, I was there 10 years. And at the end, it was still X, Y, or Z was still a struggle. We still didn't succeed in what I would call a best practice, 10 years there. And it still didn't do maybe we get consulted, for hospitals opening, and we work with some teams on helping them open hospitals. And and the things that I'm suggesting for them, sometimes I feel like, oh, wow, I wasn't even successful in getting my own hospital or the hospital we worked at to do that, even though I feel like it's a best practice. We never overcame whatever it was, the cultural norm or whatever we felt like maybe could have made practice better. But, a lot of those are your best lessons in life. The programming that didn't do well, looking back and saying, I didn't handle that well. What would I do differently this time around? And so I think that it's super important. I have a husband who loves to dissect all of our disagreements, which I love to do, of like, what was the root of this? Why did this happen? And, and it's amazing because we're both that way. And so, 10 minutes afterwards, let's dissect what happened there. You can imagine anyway, we're just that way.
You use this in fluctuation and you use the side here.
We actually do it, but it works for us, and
That's awesome.
I think that we try to learn each other that way. And I think a lot of times, you have to choose, and everyone who's worked with you in the past has to choose like grace, right? And some of the programming, this isn't a program at all, similar to Sarah's story, is just, especially if you're in a very non-Christian context, we were not in a Christian context at all where we were, and is to try to say, what, if I can show you anything, it's that when you see me at my worst, the Lord loves me anyway, the same. And if I can impart that to you, that I'm not acting like a jerk so that God loves me, but like, hey, but you know what? The lesson behind this is that we have a Jesus that like I can just ask your forgiveness to me, that he can forgive me, and that actually like the Lord's love for me is not tied to if I was nasty today. Now, that doesn't mean I don't have to work on my own attitude and things like that. But I'm not wondering, did the Lord lose his love for me today? And to try to say, what does that look like in our culture as a hospital, saying, hey, we're all going to mess up and be frustrated with each other. This is a very high intense situation, whether you're a field hospital or whether you're, at the everyday, low staff, situation that you're in, is somehow, can you just teach your staff and each other to show grace to each other really well? And sometimes we did it really well, and sometimes we didn't do it really well. But I know that the times we maybe loved the hospital the most, I hate to say this, it doesn't mean don't come and volunteer, but is when we were just low staff, and we just had our core staff, but we were all willing to just put our all into it. Fine. No, I was just saying that those best days sometimes are the days that you're understaffed, under everything, but you knew that everyone present is giving their all. And you're like, wow, today was super hard, but super awesome. It worked, the teamwork today, whether it was nationals or whatever. Like sometimes it was just like those days that were a whirlwind, whenever a bomb went off in town, which happened a couple times with us. At the end of it, you're just like, wow, everyone just like, we were on, just worked together and was gracious to each other. And like, good outcomes, bad outcomes from patient care. We're doing our best, but everyone knew that everyone was doing their best, and just, And like I said, and so some of it, I'm a fan of programming. Obviously, I'm a fan of goals and measuring those goals, and that's super important. But, the Lord has his own programming going on. And like you said, if we're willing to put our pride down a little bit and say, maybe my program today is not what the Lord's program is today. And am I actually just open to going with the flow of what that looks like today? Sometimes end up being the best days.
I just asked Joel if he can tell us where are they going next, or what is he working on right now?
So let me explain this. Samaritan's Purse, we operate in trying to have ready various hospitals ready to go at any point. In the international world of disaster emergency medical teams, there's 3 types of hospitals: a tier 3, which has 3 ORs at least or more, And then you have a tier 2, which has less ORs, and then a tier 1, which typically doesn't have any ORs. We are doubling the amount of hospitals that we're getting ready to kind of store, feed, water, so that we can deploy multiple at once. So the ideal is that we would be able to deploy four tier 3 hospitals at once. Will that ever happen?
Wow.
I don't know. But we're going from 2 to 4. And so that means anywhere from a 75 to 100 bed hospital, at any time.
Wow.
So that's what we're working on. We're trying to figure out how to strategize, how to do that well. So
yeah, that's not a small thing. So good luck with that.
Thank you.
I was just saying, where can people go to find out more about the emergency field hospital, what Samaritan's Purse is doing, what you guys are doing, or how they can get involved?
Absolutely. So you can go to SamaritansPurse.org. There you can find all the resources regarding what we do internationally with our field hospital, field offices, and that kind of work. Facebook is a big one, and then YouTube. You can kind of go see what videos have been made with our field hospitals. I know that Armenia was the most recent in the burn unit that we were a part of, and so that was kind of cool to see. But yeah,
So thank you so much, Joel, for just joining us today, and we really appreciate that. And we just love talking to you. You're one of our great friends, and we look forward to this coming out so everybody else can know exactly what you're doing right now with your life and with Samaritan's Purse and all the good things that are happening with you and what all the things that Samaritan's Purse is doing around the world. So we love them as well as an organization. So keep up the good fight there, brother.
Thank y'all. Love you guys. Thankful to get to hang out and talk to Kelly and Sarah, my 2 favorite people, and we'll be praying for all the things that God has gifted y'all in and pointing you to. So, blessings on you and your family.
Thank you.
Right. Thank you.
Hey, everyone. We hope you enjoyed this week's episode of the Christian Health Service Corps Iron to Silver podcast. Christian Health Service Corps, we are passionate about bringing quality healthcare to the world's poorest places. If you share our passion, we'd love to hear from you. Our website is www.healthservicecorps.org. Thank you again for joining us this week.